Improving Patient Experience in the Outpatient Setting by Meredith Chamberlain. For my leadership synthesis project, I decided to lead a change initiative to improve the quality of my practice environment by improving patient experience. The purpose of the project was to decrease wait times in the outpatient setting and to simplify an appointment for the patient by consolidating care. I believe this project is important because in the anticoagulation clinic, the majority of the patients are elderly and come in for blood tests on a weekly basis. Because this is such a frequent occurrence in their life, I wanted to help make the process as simple as pleasant as possible. I believe leading and participating in this project promotes leadership because it involves making the effort and using an attitude of courage to change an established system that people are used to make it better. Nursing leaders should always be looking for ways to improve because healthcare is ever evolving. According to the literature, findings show that patient waiting times significantly affect their overall perception of the visit, facility, and care. The process used in my project was service redesign, as outlined in the Olszewski article as being an effective way to increase efficiency. The collaborators and team members involved in this synthesis project included myself, the nurse manager of the unit, a lab tech, and 2 other nurses. The manager was the overseer of the process changes and did not participate much in direct patient care. The lab tech and other nurses helped to contribute to promoting the new changes, leading patients to where they are supposed to be, and informed them of the new system in place to improve their appointment. Unfortunately, my work facility does not have a quality and safety committee, or else they would have been involved in this project also. Originally, the specific aim of the project was to decrease patient wait times by 10 to 15 minutes per visit by April 8, 2016. Because this specific type of appointment for the anticoagulation clinic is usually quick, after ongoing analysis and research, I decided to edit the aim. More realistically, but still an improvement, the aim was changed to decrease patient wait times by 5 to 10 minutes per visit by April 8, 2016. According to the Institute for Healthcare Improvement, the best way to test changes is to use the PDSA cycle. This stands for Plan, Do, Study, and Act. The idea behind the PDSA cycle is to test small changes, study the results, and make necessary changes to further improve the system towards your goal. For my synthesis project, I used this model to guide my changes and make continual improvements week to week. The planning stage included making a timeline of tasks to follow to stay on track, meeting with my manager and colleagues to discuss change and goals and actions, and doing research to assist with carrying out the process professionally and in accordance to best practices. The do stage included educating the patients on where to go for the new appointment type, collecting data on the time each patient had to wait before and after the new system was implemented. The study phase included analyzing the results of the patient and colleague survey and studying the differences in wait times before and after the changes were made. The act phase includes making changes to things that were not satisfactory in the study phase. When these new changes are implemented, the cycle starts all over again until the goals are reached. In regards to the process of implementing the change, here's some background information on how the clinic used to run. When patients would come in for their appointment at the anticoagulation clinic, they would be called in from the waiting room into the lab where they would get a finger stick blood sample taken or venipuncture if necessary. They then would go to another waiting chair outside the nurse's offices to be called in again and receive their medication dosing instructions. With the new changes I implemented with this project, the appointment flows more smoothly and the patients receive all of their instructions in the lab area right after their blood test, and they never have to wait or play musical chairs. Facilitators to this project were that all the staff was on board and supportive of the changes, agreeing that they are an improvement. The patients also saw the benefit of the changes and were compliant. The only barrier that I encountered while doing this project was confusion of the elderly patients. When their blood test was complete, they were confused on why they didn't have to go wait by the nurse's office because that's how they've always done it. Once a few weeks went by, most got the hang of it with ongoing direction and the process was improved. The first chart shows the average number of minutes each visit lasted per week. The first 2 weeks, the average appointment time was 18 minutes and 19 minutes. The new system was implemented after week 2. Week 3 showed the average appointment time to be decreased to 15 minutes. Weeks 4 and 5 were 13 minutes. After seeing this plateau, the PDSA cycle was used and we made the change of taking down the old signs that instructed the patients to go to the next room. After this change, the average appointment time was 10 minutes in week 6 and 9 minutes in week 7. The second chart shows the results from both my patient and colleague satisfaction surveys. Overall, you can see this change was beneficial to the efficiency of the clinic and easy to follow as most patients and colleagues responded to the changes as highly satisfied. Overall, the impact of change was not as significant as I had anticipated in the beginning of the project, but once I changed my specific aim, I was able to accomplish the goal. Evaluation was based on timing random patients' appointments throughout the day, both before and after the changes were made. I then grouped these times in average of minutes per week, and those are shown in Table 1. The results show that between week 1 and week 7, the average patient appointment time was decreased by 9 minutes. Although that doesn't seem like a significant number, when seeing a large volume of patients per day, it adds up to allowing nurses to spend more time on other patient-related responsibilities. It's clear that even simple changes like this one can improve the quality of an overall healthcare experience. And it's clear that less waiting time and wasted time leads to better attitude and response from the patients. Thank you.